Okay. Hi, everyone. Thank you so much for taking time on your Tuesday evening to join us for this listening session. My name is Esther Kim, and I work as the Program and Research Director for the Massachusetts AAPI Commission. We were established in 2006, and we are a permanent statewide body dedicated to advocating for the AAPI community in Massachusetts. Our goal is to recognize and highlight the vital contributions of AAPI community members to the social, economic, cultural, and political life of the Commonwealth. And so we're so excited to co-host this listening session on AAPI Health today with our colleague Pata Suyamoto. So I'd love, Pata, if you could introduce yourself.
Sure. I'm Pata Suyamoto, and I am with NAPIMA, the National Asian American Pacific Islander Mental Health Association, where I am the Director of Training and the Director of a network of people with lived experience called NAPIAN, the National Asian American Pacific Islander Empowerment Network. I also work for the Mass Coalition for Suicide Prevention as a Director of Equity. And I just want to mention that we are recording the presentations, but we will not be recording the conversation. So just wanted to let you know that. And yeah, we have 4 presenters today. And we're going to be hearing a little bit about what they do and their perspectives on mental health. And then we will have a conversation, hopefully a robust one, amongst all of us, because that's really what the point is around these listening sessions, is to really hear from the community and from what the concerns are overall. If you feel like you want to, please introduce yourself in chat. And if you want to say something about why you're interested in this issue, or a little bit about what you do, if you know, whether it's relevant or not, if it's interesting, feel free to put it in the chat as well. And you know, and we will be monitoring the chat. So as speakers share, please feel free to put a question in or whatever, and we'll circle back around to it. Esther, did I leave anything out?
No.
I'm going to do the good.
I did want to just make a quick introduction. Our speakers will be introducing themselves as part of their brief remarks, but I also wanted to recognize Mabel Lam, who's here today, who is one of our former commissioners and also works as a clinical psychologist in Cambridge. Hi, Mabel. Thank you so much for joining us today.
Nice. Yes. So before we get started, I just want to put up some shared agreements, you know, ways we want to conduct ourselves in this space. And, you know, people have seen these probably a million times, but just, you know, to level set everything. You know, we're assuming mutual respect and mutual learning. We ask you to be the expert of your own experience by using I statements. Learning leaves, stories and names stay here. There will be taking written notes, but there'll be no names on those notes. Take space, make space, meaning, you know, if you are a person who is quieter, please feel free to extend yourself and take that space. And if you are a person who tends to speak up quite often, make a little space for someone perhaps who is more quiet. Care front versus confront, or call in versus call out. You know, if there is an exchange that is problematic for some reason, we can gently and with care and compassion ask a person you know, to reconsider what they said, or, you know, that kind of thing. So we want, but we don't, you know, in terms of confronting, sometimes I don't think, you know, in these forums, it's particularly helpful to, you know, be on attack mode, if you will, right? It's better to sort of say, okay, I don't understand what you're saying, or, you know, what framework are you using? You know, those kinds of asking questions often works better than just reacting. You know, embrace discomfort. Sometimes these spaces can be a little bit uncomfortable. That's different than being unsafe, though. So, I mean, I think it's really important to realize that. Oops and ouch. I mean, if you said something you didn't mean to, and we all do it, right? We say something that comes out and we're like, oops. You can say oops, like, okay, wait a minute, I need to back up, and and you can correct yourself. Ouch, if something's offensive and hurtful, you could say ouch and say, wait a minute, I this is hurtful for me. And then, we can use our call in strategies to say, this was hurtful for me for this reason, and then ask a question. Self-care and community care, if you need to get up or whatever, something hits you strangely, you need to take a minute, please do. One person speaks at a time. Intent and impact both matter, but impact is more critical to attend to, if that makes sense for people. So if when someone is impacted by something we said, you may not have intended to hurt them, but listening to why that impact was so strong and correcting ourselves is more important than, oh, I didn't mean it, I didn't mean it, right? So we need to like own the fact that we made a mistake, and mistakes are fine. In fact, that's one of the things we assume too, it's not on this list, is that we all make mistakes and that this is a learning environment. Don't make assumptions, be non-judgmental. And if something hits wrong, we can always call for a pause. Anyone can say, wait a minute, let's take a time out, reconvene, rethink it, and go forward. Does anyone have any thoughts or concerns or questions about those set of shared agreements? Okay. All right. And happy birthday, Mabel. Happy birthday. Yes, that's lovely.
Thank you.
And for you to come on your birthday, in the karmic world, you get extra points.
Well, thank you. I
Yeah.
need all of that, as much good karma as possible.
Yes, I think we all do. So okay, let's sort of jump in. And we're going to start with Chin Chi.
Hello, everyone. It's so nice to be here with all of you. I've worked with some of you, and I know some of the people in the audience as well. So many of you probably know me as the founder and former executive director of Asian Women for Health. But before I started the nonprofit organization, I actually work as the Asian Community Program Manager for the Massachusetts Council on Compulsive Gambling. So I am an immigrant from Taiwan and a breast cancer survivor turned patient advocate. And I have both personal and professional experience working with people in the recovery field. So when I was diagnosed with breast cancer, I had a drug-induced psychotic manic episode. And so mental health is something very close to my heart. And that's why I started the Asian American Mental Health Forum in 2010. And I'm very proud to say that throughout the year, this has become a all volunteer run annual conference. And we have a very strong voice for the peers. And I'm very happy to be here today to share with you my experience working with the Asian community. So one of the questions that was asked is that how do we define or explain mental health or wellness for the AAPI community? So my take on this is that I know that mental health is a taboo. We don't want to talk about mental health with our family members, with our friends, with our coworkers. But it is something that it's really impacted everyone. Doesn't matter if you're a man, woman, kids, teenager, seniors. And this is something that really, really devastating our community, especially, during the pandemic, the anti-Asian hate further exacerbate the feeling of isolation, the depression, the anxiety. And what I always tell people is that think of mental health or behavioral health as a disorder or disease. So if you break your arm, if you got a cold, you will want to go see the doctor. So when you are not feeling well mentally or emotionally, then you need to see specialists. And so there should be no shame in that. We should really be okay about not feeling okay, and then just, because we have a tendency try to just jump in and try to fix people's problem. But we need to learn to let people sit with their feelings, and then also to provide people with with ways to express their feelings. I remember when I was working with the hospitality communities, I did like distress workshop for the immigrants and for the hotel workers. And one thing that I help them to do is I try to use simple icons and signs like the weather to help people to express their feeling, their emotions, so they can feel that they can tell people how they feel. So for example, I use the icon sun as a sunny and say that that's, I'm happy. But if it's cloudy, that means that, I'm sad or I'm feeling gloomy. So those are the kind of things that I think that we can do to help our fellow Asian Americans to, try to destigmatize the mental health issues and to make it normalized for them to seek help. And one of the things that I think it's very much needed in our community is that we need to have more people from our community who can work as a peer specialist or recovery coaches or therapists in this field, who are bilingual, bicultural, who can provide culturally and linguistically appropriate care and support for our community members. So I'm going to stop right there, and I'll jump in later and to listen to my fellow panelists.
Thank you, Chin-Chi. Appreciate your perspective. Dawn, do you want to join us with your thoughts?
Sure. Hi, everybody. I recognize several familiar faces, and it's really good to see a lot of you. I haven't seen you, Audrey, in a long time, so it's so good to see you. But anyway, I am Dawn. I am the co-executive director and clinical director of the Asian Task Force Against Domestic Violence. I'm a licensed clinician and have been in ATAS for about 11 years now. I'm originally from Hawaii, and I'm biracial Japanese and white. At ATAS, we provide, or the Asian Task Force Against Domestic Violence, if anybody's unfamiliar with our work, but we provide holistic services to Asian survivors of domestic violence and sexual assault across the state of Massachusetts, and sometimes with victims in other states due to the scarcity of responsive services for Asian victims nationwide. We serve a highly marginalized population. About 99% of our clients are Asian, 95% are limited English proficient, and the majority are single moms. Our multilingual staff, which include 12 advocate case managers, collectively provide services in 23 Asian languages and dialects. Our programs include a 24-hour hotline, community-based services, language access program, emergency shelter, legal program, ESOL program, economic empowerment program. We also provide outreach and community engagement to raise awarenesses on issues impacting Asians in the community and informing of ATAS services. Our services are free and confidential and available to documented and undocumented service persons. Our work, and so one of the questions was how our work sort of intersects with mental health, and it does so in two broad areas. One of the more obvious is supporting victims or trauma survivors in their mental health and wellness journey, which can range from anywhere from emotional support provided by their advocate to linking them to a therapist. Less obvious, but incredibly prominent in our work is how systemic barriers impact a survivor's mental health and wellness every day when they don't have access to adequate health care, are socially isolated, and oftentimes new immigrants are informationally isolated, and oftentimes somebody who is limited English proficient is forced to, and also when they're forced to work at non-living wage jobs, when they're living in unstable housing. These factors and many more cause a person's mental health and wellness to deteriorate, and are root causes of mental health wellness and are systemic in nature. So sort of moving on to the next question, what is it, how do you define mental health and wellness in API communities, or what does it feel like? And ideally, it would feel like an environment where health, education, social, economic resources are equitable and inclusive. And what we've heard through the community and through clients as to what that means and what that would feel like is the existence of spaces for communities to gather, to build relationships and to identify common needs. And that's incredibly important when you're an immigrant and a new immigrant, when you leave your country and you don't have those same community networks and support systems. Another thing, in addition to community space, is the ability to feel safe. Many Asians have been made to feel unsafe in their own neighborhoods, at the local grocery store, on the T, at work. So finding those ways to feel safe in their own, even private spaces. Access, another area is access to information and resources on topics ranging from mental health and wellness and where to seek help in your language. And additionally, echoing Chen Chi, the availability of encouragement of culturally responsive services. I think I'll jump down now to sort of policies and sort of other steps. And so one thing that we're having a lot of conversations around, both internally and externally with community partners and other collaborators, is how to think about mental health and wellness comprehensively. A person's feeling of helplessness and hopelessness, a lack of sleep, anxiety, and an inability to focus may be directly linked to the fact that they're living paycheck by paycheck, that their rent just increased and they can't increase their work hours because that means that now they need to pay for additional childcare. So offering and connecting them to therapists is not a priority on their list. It's stabling their finances, and how do you connect them to those resources so that they can move on to their own mental health and well-being journey. And at the systemic level, advocating for policy and protections for employees, for living wages that meet the continually rising costs of housing and childcare, education, and other essentials. It's concerning that the minimum wage in Massachusetts, for example, is $15 an hour. And for somebody who is limited English proficient and has very few jobs options, it's probably even, and not even probably, it is less than that. So how do you make a living wage off of that? And how does that contribute to somebody's mental health and wellness? So I think I'll stop there, because I also echo a lot of what Chen Chi is saying around the need for culturally responsive in-language mental and behavioral health services.
Thank you, Dawn. That's great. I feel this building, which I think is wonderful. Heidi?
Sorry, my ADHD is sort of playing out because it's a strange ray I can't get rid of. Just like this cat trying to. All right. Anyway, yeah. So introducing myself. So my name is Heidi Hyunjin Lee. Yeah. So essentially, I started out trained as an artist, an art educator, taught in various school systems in Boston specifically for about 10 years. And then sort of moved on to, community organizer, directed an art program in Boston for those experiencing homelessness, which then led me into Boston Healthcare for the Homeless as a case manager. And they are kind of like interconnected. I don't have time to explain that, but yeah, I think that a lot of it ties into my determination to preserve human dignity. And I think at the high school level, at the community level, and obviously on Mass and Cass, there's pretty much all of that intensified. So yeah, my role right now is as a harm reduction case manager at Boston Healthcare, both serving in the clinic, in the building, as well as outreaching on Mass and Cass. And so my relationship, actually, I was just thinking about that. I don't think that I really did anything specific to AAPI mental health until Chen Chi sort of lured me into Asian Women for Health. And I am all the better for it. A little bit of tactful harassment on Chen Chi's part, but I love you, Chen Chi. And I've met tremendous people through that community and I realize it's kind of like, just like how different entities and organizations are not just the organization in itself, it's the people that compose that entity. So I'm really grateful that in the years that, Asian for Health has changed, that all the relationships have maintained. How do I define? This is, yeah, huge. Because, I was thinking about this, like mental wellness and how that plays out. For me, like I have to see stories. And obviously I won't tell a long one, but, I think about the Vietnamese refugee patient or the client that I was serving who was, early 70s, staying out on mass and CAS. You should not be sleeping out in any shelter or any, street when you're of that age, right? And essentially, he came up to me, and usually when a person on Mass and Cat says, "Where are you from?" I usually say, "I'm from Boston. Where are you from?" But he genuinely looked at me, and there aren't many Asian case managers out there. So we connected and we got housing for him. And the thing that held him back was that he required an F code, meaning a mental health diagnosis, to get housing. And he refused to get an F code because he said, I'm not crazy. I refuse to be labeled with mental illness condition. And we had to explain to him, like, you are a refugee who's been through war and has been through hardship. And essentially all we're trying to say is that maybe it has been challenging for you to get housing because of your challenges from your experiences. And essentially he did get housing, but that story and just the contrast of my friend who has a daughter who got a full ride to RISD, essentially like the Harvard of art schools, and, not refuses, but really struggling to get her daughter mental health care because it's like, I've worked up for my child to get to this point, and now to ruin all with her getting a mental health diagnosis. Like, those are both valid. Like, one highly educated, extreme different socioeconomic status, and this gentleman here living out in Mass and Cass. But that is kind of represents the ranges of the AAPI community, and not even mentioning and I only speak when I understand these things from the perspective of, Asian American, East Asian, like Korean American, and not really understanding, Native Pacific Island, South, East Asian and all such. So, I think that even that, like, to understand, like, to group it all to AAPI, it's really hard. But sorry, so I'm just gonna just cut me off whenever you need to. So, the question about resources and policy changes, I almost feel like we need to first really tackle the defining what mental health and wellness for our community, and not to like generalize it, our community as all the same, as I just mentioned, but really understand what that means. What does wellness mean amongst the diversity of this community? Because until we tackle that and are willing to talk about these hard, difficult, uncomfortable conversations, we really can't get to the resources and policy changes quite yet. Mind you, there are really courageous people tackling it on their own, in their own, and groups and their networks, policy changes, and trying to promote resources and such. But in all honesty, like, people who are resourceful will always find resources, and policy people will always be doing their policy work. But for me, when I see policy, and I'll speak in terms of what I know, which is policy for homelessness and substance use, which is my primary focus. And as a side note, I do not see many people out there struggling as Asian Americans on Mass and Cass. He was probably one of 3 people I served in 3 years who are Asian American. And that is certainly not because Asian Americans do not struggle with substance use. And so I think that when I think about policy, it's effective when I see it on the ground level. When I see policy changes about homelessness, trauma, and mental health, challenges and substance use, when I see the policies up there and I see it being played out on the ground level, that's when I know that the policies are being effective. When it's all up there and all of them are having their, parties and talking about their language and their, jargon, it's just all up there. You know what I mean? So I think in the end, policies are just policies. If it doesn't tend to the people who are suffering the most, then they're just pieces of paper that haven't really gotten down to, theory and praxis.
Thank you, Heidi. Thank you. Ashwarya?
Hi, everyone. Wow, it's so lovely being in the space and being with so many passionate people. I'm just like taking it all in. My name is Aishwarya. I currently work with AAPI communities in 2 capacities. I'm currently employed at Clinical Alliance Services, which is a group private practice in Cambridge, providing psychotherapy and trauma treatment. So I really want to be focusing on like bicultural identities, and like what it means to, be caught between 2 worlds. And I also work as a prevention specialist at Sahaley, which is a domestic violence and sexual assault agency in the greater Boston area. And it primarily caters to North African, South Asian, and Middle Eastern communities. And so my role right now is working to sort of prevent some of these issues from arising amongst like youth. So talking about mental health with like youth from these communities, talking about what healthy relationships should look like, their bicultural identities, and really addressing these issues within their communities. And so the sort of the second question about what good mental health looks like, and could be defined like, I've been trying to ask myself this question of like, what brings me joy and what brings me affirmation and what can lead me to live a life that's truly sustainable and brings me these moments where I can really get to know myself. And I think that like a really key piece of supporting your mental health and like building a sense of wellness is creating a sense of identity and belonging. I think that we're rarely asked these questions as we grow up, like what it really means to, be Asian American and all like, and what it really means to be Asian and both American. And like really asking ourselves, like, what do we value about our culture? What would we learn from our culture? What pieces of our culture bring us the most pride? And then what are those pieces that bring us shame, guilt, those more complicated emotions, and really learning how to tap into that, even though it's hard as shit. And like, that's, I think, where we can really start to see some real growth and a sense of actually knowing yourself, since, knowing yourself and relying on yourself is like the biggest piece of all of this. And so this third piece, like that's been echoed, right, is like, how we can sort of get to this place where we can bring, have people access more culturally attuned services. I think that that's a really key piece of all of this. I think that for me, at least, like what I'd really like to see is like how we can bring more AAPI folks like into this space. Like it took me a long time to get here because there are so many expectations on like what I should be doing with my life and what success looks like and what it really, means to succeed, especially like in America. And so I would have loved, to see someone get to a place where they're a therapist and like known what that pathway looked like. And had it been more, I guess, accessible to youth, as like, like just everybody in this space and like how they got here today, like that knowledge for a younger version of me would have been all the more valuable. So that's really where I would like to see a lot of growth. And I'll stop there. Thank you so much.
Thank you all for sharing your experiences and your perspectives. I hear a lot about, well, certainly culturally responsive, appropriate services. I hear a lot about the systemic issues, both in terms of safety and, like all the social determinants of health, right? Racism and oppression and, homelessness and financial insecurity, all those kinds of systemic issues. And also, this question of like the importance of identity and belonging, and just, that a strong sense of cultural identity is actually a suicide protective factor, a protective factor for suicide. So, I mean, when we think about these things, they actually have, it's not just, oh, isn't it nice to belong? It actually has an important mental health perspective. And I just wanted to say before we get into the conversation amongst all of us, is, one of the things NAPIMA really promotes is the idea that mental health and wellness is actually, everyone has it and it's a big concept, right? I mean, it's a big bucket, right? And that it's not, mental health is not mental illness per se, right? I mean, mental illness is part of the landscape, but we all have mental health, and whether we have a diagnosis or not, we have times when we struggle, we have grief, we have all these other things, right? And that we need to think about ways as a community, as individuals, as family members, as a community, to support each other in our own mental health journey, as John puts it. And I think I think we all have mental health journeys, if you will. Some of us, like myself, have, ones that include mental illness and other people don't. But if we think of it that way, maybe we can normalize it in a way that is not so stigmatized by our various communities. So we'd like to, does anyone, first, does anyone on the panel have anything else they want to add before I open it up for everyone to share? Everyone's good?
I want to add in just, I think it was maybe one of you said something that made me think about something else. And it's just kind of like how I feel like, for speaking from the sort of 1.5 generation, I say 1.5 because my parents are first generation. And I came when I was about 6.5, so I wasn't quite second. So I kind of say 1.5. And I think that the sort of transition between thinking in that sort of more collective mentality where they came from, and sort of me growing up in this kind of individualistic mentality, and what that means in mental health and self-care, because there's so much promotion of like, come on, mindfulness and all these self-care things at work that they sort of have you do. I think that it's almost like with the languages, when you go to school, you speak English, and you come home, you speak another language. It's almost like jumping back and forth between that kind of collective mentality where you watch your parents sacrifice everything for you and others. It's like this, you do everything for the community and family and all such. And the individualistic mentality of you do as much as you can for yourself. And it's not so much a selfish thing, I'm realizing, but it's kind of like merging the two, where I'm understanding that mental wellness for or at least myself as an Asian American, I see it as like taking the beautiful things about both and also recognizing the weaknesses of both, and understanding what that means as I pass it down to my son, who's now, what does that make him? 2.5? I don't know.
Thanks, Heidi. So we want to open it up, and I'd like to invite